Hello and welcome to this week's What Were They Thinking? There's not been a lot of news around COVID-19 itself, no great new discoveries or anything similar. What we instead have is almost a return to the status quo. In America, there's been a massive increase in the single-day incidence or rate of new infections for the CCP virus. As of the middle of this week past, more than 36,000 new infections were identified on one day. This is a big problem considering that America was getting this disease under control. In just 3 states, California, Texas, and Florida, more than 5,000 cases were reported in each state. That means nearly half of the new incidences can be traced to just 3 states. The current leading theory behind this sudden increase is the relaxing of the various restrictions put in place to control the spread of the CCP virus. This is accompanied by a mixed criteria with each state deciding what it thinks is the best reason and best means to execute the relaxation of the rules. Think of it this way, if everybody's playing to different criteria, then everybody has a different degree of control or conscientiousness behind what they can and cannot do. This means some states are far more liberal in what they've allowed, thereby allowing the spread of the disease. In other states, it's remained quite strict. Unfortunately, the lack of high impact that's been anticipated if the country had not gone down this path of lockdowns has led to a great deal of complacency, and complacency to a degree will breed contempt, and that is exactly what we are seeing. Contempt for the CCP virus has led to it biting many of the states hard. This feeds into one of the quotes coming from Fauci. The question is, will they have the capability to do the appropriate and effective isolation and contact tracing to prevent this increase from becoming a full-blown outbreak? I'm concerned it's happening. As said, complacency has bred contempt, and it's only getting worse the longer America has to deal with this. This also feeds into some of the things we're seeing with how deadly it really is. Statistically, it is significantly more dangerous than the average flu, but that is the closest comparison we can draw in many cases, or at least the one people are familiar with. The CCP virus sits somewhere between influenza and SARS. This explains why, compared to the 0.1% of people who are infected with influenza and die, 4.9% of those infected with the CCP virus are dying. That's a 49-fold increase. Not only are we seeing a drastic increase in the numbers, but it's the age groups that are most vulnerable that are most concerning at the moment. Most Western nations have a statistically high aging population. This means the bell curve has shifted to the older age bracket. That means there are more people over 55, 65, 75, and 85. The problem for these age groups? They are the ones most likely to die from the CCP virus. Mostly it owes to frailty from age. This number gets worse when you are over 85, where there's a 30% fatality rate. At the moment, we have no answer to the disease itself. Realistically, all that can be provided is palliative care and support. This means ventilators, pain relief, and hopefully patients will recover. There are, however, a few promising leads. The World Health Organization is pushing one of these particularly hard. It's called Dexamethasone, and it's a steroid. Not only is it a steroid, but as was the case with hydroxychloroquine, it's an established medication with a clearly understood safety profile, but most importantly of all, unlike other drugs being investigated, it is relatively cheap. The World Health Organization is pushing this hard after a British trial found that it could indeed have an effect that was useful in relieving symptoms and reducing the severity of the disease. It involved a relatively large study of 2,000 patients, and it seemed to show it reduced death. This is good until we can get a more substantial solution in place. The problem is increasing production to meet the global demand under present circumstances in such a way that companies that are increasing the supply don't bankrupt themselves for a short-term gain. The World Health Organization has stated a need to use this in particular cases, primarily patients who are extremely ill. They are also stressing the need for some sort of intervention that's working. Their concern rises from the earlier mentioned records, not just the American record though. Across the world, there was 183,000 new cases. That is the highest record for a single day increase across the globe. Match this with the fact that some countries are seeing a resurgence, and we have a problem. Not only is COVID-19 affecting people through lockdowns and resulting economic collapses, there are issues with research and ability to test new drugs. A number of companies have publicly stated to different publications that they are either unable or unwilling to run experimental research in the form of clinical trials while the CCP virus is in the way it is now. Now, this makes sense, mostly because you need to understand a clinical trial should be run under normal circumstances. That means participants should be able to continue their normal lives, whether that's employment, physical activity, socializing, and so on. The current world state is hardly normal. This means a number of companies have simply said, we're not running any at the moment, and we may resume clinical trials in 3 to 6 months' time. This means a number of drugs that were slated to start in the near future will not happen. This may push back treatments for a number of diseases by months, if not years. While we're talking about outbreaks and similar, it's worth keeping in mind how we actually figure these things out. Primarily it's done through modeling, and with any luck, Japan just got a huge leg up in terms of creating computer models of anything really, not just diseases. They have just reached the #1 position for supercomputer speeds. That is, they currently hold the #1 position for the top 500 fastest supercomputers in the world. The computer was called Fugaku Supercomputer, and it was built in the Riken Institute. Riken is Japan's research body, or its peak research body might be more appropriate. Between that and collaboration with Fujitsu, they have built the most powerful computer that can run at 415.5 quadrillion computations per second. That's 415 petaflops. 1 petaflop is roughly 1,000 tetraflops. The newest generation of Xbox and PlayStation have about 12 teraflops each. You can do the math, but it's ridiculous how much more powerful this still incomplete supercomputer really is. That's an important point to keep in mind. It is not yet fully operational. It is hoped that by either late this year or next year, they will have finalized the construction and installation of all of the units for this. The way it's built, being a supercomputer, it's not like a standard PC or laptop. It takes up an entire room, much like the ancient supercomputers of old. The difference between this and other similar supercomputers currently being built or available is that it's based on different architecture. Previously, it would be a combination of CPU-style units, but rather than go with the discrete CPU construction, they've opted for something known as ARM architecture. ARM is what you would find in either the new iPhones as they come out in the future, or even in some tablets and laptops now. There was an idea put forward years ago called Moore's Law. This argued that every year computing power should double. In recent years, we've not seen that, but then again, it's very much doubtful that Moore would have expected us to ever reach this point where we are able to crunch such significant quantities of data in such a short period of time. Just consider how many numbers go into the most basic of calculations that these computers might run. While on the topic of numbers, we have an interesting case study for you. It describes a brain injury that led to a man being unable to see numbers. It's not a poor excuse to avoid maths homework, but instead a diagnosis that after he was injured at work, the man was unable to perceive the numbers 2 to 9. This is a problem for that poor bastard, given that he is an engineering geologist. What is really bizarre about this is that he could understand if it was written as a word, and even the numbers 0 and 1, but not the numbers 2 through 9. This has obviously raised a lot of interest in various circles, and it led to a number of years where he was working with a research team to try and figure out what was happening. Initially, there was some thought it might be psychiatric in origin, but through working with a psychiatrist, that was thought to be an unlikely option. Eventually, they started working in other areas, trying to use proxies to measure what was going on. This worked for a time and they could get a few useful details, but ultimately they went to direct measuring of his brain using an EEG. What they found is really bizarre. His brain does process that the numbers are there. It recognizes that the numbers are there. Everything is there except for that last step that requires his brain going from, here is something you are seeing, here is what that thing is, to actually telling the rest of his brain what that thing is and what it means. In our next piece of news, we need to look at NASA, and it's going around and continuing its efforts to recognize people in its past who have contributed in various ways. One of these is Mary W. Jackson. She was an engineer in NASA's laboratories in a period that's generally considered rather dark. As a consequence of that period and other activities, NASA has been actively trying to recognize those people who in its past have contributed to its present success. This has led to them renaming the headquarters building to the Mary W. Jackson NASA Headquarters Building. We are left wondering whether or not this is political shenanigans or an actual effort to recognize people of the past. Either way, NASA has been going along and doing a lot of work in an attempt to recognize people who have been involved in its success throughout the years. And this may well confuse a lot of people who have written about NASA before now, as their old material may no longer reflect the names of buildings and locations accurately. Finally, a little bit of old news, but something that we found incredibly interesting but ridiculous. Minnesota schools have decided to ban both Harper Lee and Mark Twain due to racial slurs within their books. These are two incredibly notable authors for their period. At least one, Harper Lee, wrote a book that points out the underlying premise of tolerance, understanding, and standing up for others in the form of the book known as To Kill a Mockingbird. Despite this, for some reason, Minnesota is concerned that the use of racial language within those books from a period long ago where it was the norm would somehow create a problem, primarily the humiliation or marginalization of certain people. Consider that some of the key themes of To Kill a Mockingbird are the nature of good and evil, education, social inequality, perspective, racism, bravery, and the law. It's odd that they would feel that this would lead to those very same positions. If it's a reflective piece, then you can take away a lot and understand how far the world has really progressed today compared to how it was over 100 years ago. Then again, it is well worth noting that in the roughly 100 years that have recently passed, the world's population has doubled. We have the internet, global travel, medicine of all kinds, and yet we can't bring ourselves to reflect on something as simple as a book like Huckleberry Finn or To Kill a Mockingbird. While preparing the final edit for this video, we came across this last little bit of interesting news, and it's more of an opinion piece. Anthony Fauci, who is the White House's task force leader for the CCP virus, has argued that there is an increasing risk of Americans not only spreading the CCP virus, but that there's an anti-science sentiment growing. He uses the word bias, but we can see this in other areas. Only recently we received a number of tweets where arguments were being made that even if something like a lockdown order was there, it wasn't working, not because it doesn't work, but because people were not following it. This is logically inconsistent, the argument being that the thing has failed because it failed does not argue why it has failed. This leads to the current problem of, well, what we've been mentioning for a while. There's an issue with what's being said and how it's being communicated. This means many people are receiving news, and it'll often be a mixed message. One authority says this, another authority says that. This ultimately means that they have to pick a side, and that may mean that they're choosing something and becoming invested in it. Fauci draws a comparison between this and anti-vaxxers, and it's quite a good one. The idea is that there is expert advice, and often expert advice suited to local conditions. Then again, people are saying, but this other organization, completely detached from the local situation, is saying we should do this instead, often based on a different data set. That's a problem. You can't extrapolate one set of results and try and apply them to another data set that's completely unrelated. He even identifies within his own response to some of the questions raised what the problem is. People don't understand the implications of not only what has happened, but what could have happened. Instead, they argue what has happened wasn't adequate, or because it occurred and there was no great pandemic, therefore it was unnecessary, not understanding that there could have been a worse circumstance if things had not gone the way they did. That is the last of the news we have for you this week. Thank you for watching. If you have found it interesting, consider liking, sharing, and subscribing. Please post any comments, questions, or suggestions you might have below.